Hello, Brad here from 999 KnowHow. In this video, I'll be going through the basics of cardiac conditions and how to recognise them using ECGs. I will also be going through the anatomy of the heart and common cardiac conditions. So, let's get started. First up, let's take a look at the heart's anatomy. The heart has 4 chambers: the left and right atria, and the left and right ventricles. The right side pumps deoxygenated blood into the lungs, while the left side pumps oxygen-rich blood to the rest of the body. Knowing how the heart is structured helps us understand how cardiac conditions affect blood flow around the body. Check out my cardiovascular system video, which covers this system in more detail. Now let's look at physiology. The heart's main job is to pump blood effectively. It does this through a synchronized electrical system that triggers contractions. Under normal conditions, the heart beats between 60 and 100 times per minute, depending on factors like activity level and emotional state. Now let's look at the electrophysiology of the heart. The heart has an electrical conduction system, which includes the sinoatrial node, atrioventricular node, and bundle branches. The SA node acts as the natural pacemaker, setting the rhythm for each heartbeat. A normal sinus rhythm refers to the natural, regular beating of the heart, typically between 60 and 100 beats per minute. It originates from the SA node and is the normal rhythm in healthier individuals. Any deviation from sinus rhythm, such as bradycardia, tachycardia, or arrhythmias, indicates an abnormal heart rhythm that may require medical attention. Let's take a closer look at some key arrhythmias, focusing on bradycardia, tachycardia, atrial fibrillation, and supraventricular tachycardia. This is when the heart rate drops below 60 beats per minute. While it can be normal in well-trained athletes, bradycardia in other individuals may indicate an issue with the heart's electrical system. Is when the heart rate is extremely low, typically below 40 beats per minute, and is a serious condition requiring immediate medical intervention, as it can lead to insufficient blood flow to the body's organs. A heart rate over 100 beats per minute, often caused by stress, exercise, or infection. Persistent tachycardia can signal conditions like atrial fibrillation, ventricular tachycardia, or SVT, and may require medical attention. Supraventricular tachycardia is a condition where the heart suddenly beats much faster than normal due to abnormal electrical activity above the ventricles. Episodes can last for minutes to hours and typically cause palpitations, dizziness, and shortness of breath. It is a serious condition requiring immediate medical intervention, as it can lead to insufficient blood flow to the body's organs. Atrial fibrillation is a common arrhythmia where the atria beat irregularly and out of sync with the ventricles. This can increase the risk of blood clots, stroke, and heart failure. Ventricular tachycardia originates in the ventricles and is characterized by a fast heart rate exceeding 100 beats per minute with wide, abnormal QRS complexes on an ECG. VT can present in 2 forms. In pulsed VT, a pulse is still present despite the rapid and abnormal heart rhythm. While the heart is still contracting and circulating blood, the patient may experience symptoms like palpitations, dizziness, or shortness of breath. Immediate medical attention is required to stabilize the condition and prevent deterioration to a life-threatening state. In pulseless VT, the heart is beating too fast and inefficiently, failing to pump blood effectively, which results in the absence of a detectable pulse. Pulseless VT is treated as a cardiac arrest and requires immediate life-saving interventions including CPR and defibrillation. Both forms of VT are medical emergencies, but the presence or absence of a pulse determines the course of treatment. Unrelated, VT can lead to ventricular fibrillation or cardiac arrest. Ventricular fibrillation is life-threatening and causes the ventricles to quiver instead of contracting, leading to a sudden cardiac arrest. Immediate defibrillation is needed to restore normal rhythm. Pulseless electrical activity refers to a condition where there is electrical activity on the ECG that would normally indicate the heart is beating, but there is no actual mechanical contraction of the heart muscle, so no pulse can be detected. The heart is not effectively pumping blood despite the presence of electrical signals. PEA is a type of cardiac arrest and requires immediate treatment, including CPR and addressing any reversible causes. Unlike VT, defibrillation is not the primary treatment for PEA, as it is not caused by an arrhythmia like ventricular fibrillation, VF, or pulseless ventricular tachycardia, VT. Instead, the focus is on identifying and treating reversible causes, often referred to as the H's and T's, which include hypoxia, hypovolemia, hydrogens, hyper or hypokalemia, hypothermia, tension pneumothorax, tamponade, toxins, and thrombosis. Asystole, known as flatline. Asystole is the absence of electrical activity in the heart. Immediate CPR and advanced life support are required as asystole cannot be treated with defibrillation. Now let's look at some common cardiac conditions you might encounter. Myocardial infarction or heart attack. And this occurs when blood flow to part of the heart is blocked, usually by a blood clot. Symptoms include chest pain, shortness of breath, and profuse sweating. Angina, and this is chest pain due to reduced blood flow to the heart. It often occurs during physical activity or stress and usually resolves with rest. Heart failure is a condition where the heart can't pump enough blood to meet the body's needs. Symptoms include fatigue, shortness of breath, and fluid retention. Arrhythmias, irregular heartbeats that can be too fast or too slow or erratic. Common types include atrial fibrillation, bradycardia, tachycardia, and ventricular tachycardia. Congestive heart failure, a specific type of heart failure where the blood struggles to pump effectively, leading to fluid build-up in the lungs and other parts of the body. Let's move on to the electrocardiogram or ECG. An ECG records the electrical activity, providing information about its rhythm, rate, and overall function. It helps detect abnormal rhythms, electrical conduction issues, and even damage to the heart muscle. Key components of an ECG include the P wave, representing atrial depolarization, or the electrical activity that causes the atria to contract. The QRS complex reflects ventricular depolarization, which triggers the ventricles to contract and pump blood throughout the body. This is the largest and most prominent part of the ECG waveform. The T wave shows ventricular repolarization when the ventricles reset and prepare for the next contraction. Recognizing these elements and understanding their timing is important for interpreting heart rhythms correctly. Any abnormalities in P waves, QRS complexes, or T waves can indicate issues such as arrhythmias, ischemia, or electrolyte imbalances. Let's go through some common medical terms related to cardiovascular conditions. Ischemia, which is reduced blood flow to an organ or part of the body. Palpitations, rapid or irregular heartbeats. Cardiac arrest, a sudden stop in effective blood circulation due to the heart's failure. Defibrillation, using electrical shock to restore a normal heart rhythm. And finally, telemetry, which is continuing monitoring of a patient's heart rate and rhythm. Let's take a quick look at a real-world scenario that you could encounter. Imagine you're on scene with a patient complaining of chest pain. After performing a quick assessment, you obtain an ECG. The ECG shows ST segment elevation, and this can indicate myocardial infarction or heart attack. Recognizing this pattern allows you to take immediate action, such as administering aspirin and preparing for advanced medical help. Let's quickly recap what we've covered. The heart consists of 4 chambers. Its physiology involves effective blood pumping and maintaining rhythm. Common cardiac conditions include myocardial infarction, angina, heart failure, and arrhythmias. Key arrhythmias include bradycardia, tachycardia, atrial fibrillation, and SVT. Electrophysiology refers to the heart's electrical conduction pathways. And an ECG helps us monitor the heart's electrical activity. Thanks for watching. If you found it useful, please give it a thumbs up and subscribe for more insight into emergency care. Have any questions or topics you'd like me to discuss? Leave them in the comments below.